Hello everyone. Today I want to talk with you about pulpotomy and pulpectomy. So, first of all, we need to know about the pulp zones. So, the pulp zones are that includes dentin, odontoblastic layer, the cell pore zone, cell rich zone, and the pulp proper. Now, what is pulpotomy? Pulpotomy actually is the removal of the coronal part of the pulp. Coronal part, remember this. So, what we do is that remove it by an excavator and then also adding medications. Medications could be ferric sulfates, another medication known as formoterol. So, this ferric sulfate is used to stop the bleeding, okay? Because once we expose the pulp, there's going to be active bleeding and we use this ferric sulfate to stop the bleeding. And then we have this pulpectomy. While pulpectomy is the removal of the whole content of the pulp chamber plus root canal. Okay, so this is like pulpectomy is basically the entire, we do the entire endodontic procedures, while pulpotomy is the beginning, so we just remove the coronal part because we won't do the normal endo. Usually, this pulpotomy is done in young patients because they have let's say, the ability for a better result. Um, Now, here is a little chart. It's a pulpotomy where it's not little, but it's pulpotomy versus pulpectomy techniques about its indications and complications. So here you can see that pulpotomy, okay, as we said it right here before, is the removal of the coronal part of the dental pulp, correct? Which is followed by application of a medicament. So indications, when do we do pulpotomy? We do it in vital teeth when they have a healthy periodontium and also only in the coronal involvement. So only when the bacteria or the caries, let's say, involves the coronal part. If there's for example, an apical abscess or apical inflammation, then this is not an indication because it doesn't make sense. Then we'll have to do the pulpectomy. Okay. For example, if there's any contraindications for extraction of the teeth, absence of infectious abscess, just what I just told you, absence of fistula, spontaneous pain, absence of involvement of the pulp floor, absence of interradicular bone loss, and etc. Now, what are the complications with pulpotomy? We could have anesthesia complications, we could have tooth fracture, tooth discoloration, and persistent pain because we're basically, it's like cutting a hand, like for example, imagine a human that there's a virus, let's say, and it's spreading from the hand to the body, and for us we want to stop the spread, so we cut the hands off. It's painful for the patient, for that human. It's might make life harder, but we saved the life. This is kind of it's not the same thing, but it's like it's a good example. Now with pulpectomy, we remove the whole contents of the chamber, which is endodontics, basically. Indications are for non-vital teeth, if there's any furcations, coronal and radicular involvements, and etc. You can all see here, it's all listed here. And with complications, we got here. So it's kind of the same complications as these, but as pulpotomy with some extra. Okay? Now, there's two types of pulpotomies. We have one visit pulpotomy and two visit pulpotomy. Now, in the one visit pulpotomy, so what we do is that, so we place the wool moistened with the formazole, and then we apply the antiseptic dressing, which includes zinc oxide with eugenol. We place the lining and we restore the tooth. While the two visit pulpotomy is that first we complete the cavity preparation. We apply the devitalizing paste to exposure on the cotton. This devitalizing paste could be, we use here something called Toxavit. So what is that? I think it's the brand name, and it's like a black, let's say, paste that we apply a little on the pulp, and we let it sit for here. You can see we cover it with the cavite or the temporary restoration, and we reappoint for 1 to 2 weeks later. So that devitalization paste needs to stay in the tooth for 1 to 2 weeks, and then they have to come back for another time, and then we do this pulpotomy, let's say. Okay, so when for pulpectomy, it's important that you use a resorbable material, for example, non-reinforcing oxide eugenol, which this is actually a combination of iodoform and a calcium hydroxide. Okay, it's also known as Vitapex or Metapex. So those are like the industrial names, you could say. And also, and after that, we have to use. So it's used to fill the canals. So we use these materials to fill the canals. So that's for pulpectomy. And so there's also this technique also called SWEC pulpotomy. So what you do is that you remove 1 to 3 millimeters of the coronal pulp. This is not milliliters, it's millimeters. So yeah, you remove 1 to 3 millimeters of the coronal pulp, which involves the preservation of the cell-rich coronal pulp tissue. Okay, this is more likely for the so it's more likely for the healing of the radicular pulp. So basically, by preserving the cell-rich tissue, we promote the healing process.